Hello, my friends. My name is Dr. Saeed Kazmi. Welcome to this presentation on how doctors can clinically differentiate between some of the common causes of upper respiratory tract infections, namely common cold, influenza, COVID 19, respiratory syncytial virus, and some other viral infections, based solely on symptoms and signs, especially if you are working in a resource constrained settings where some testing may not be readily available. So let's roll the dice. Now, before we begin, let's have a brief overview of the respiratory tract, especially the upper respiratory tract. Now, the upper respiratory tract includes your nasal passages, your pharynx, larynx, and the trachea. These structures are responsible for filtering, warming, and humidifying the air that we breathe. Most of the viral infections always infect any part of this upper respiratory tract, or sometimes they do in a continuum and can go further down to become a lower respiratory tract infection as well. In other words, most of these infections they always begin somewhere in the upper respiratory tract, and though in most of the cases they would remain confined to the upper respiratory tract infections, they can sometimes go down and become lower respiratory tract infections as well. So let's start by briefly talking about these common viral entities that cause upper respiratory tract infections. So the first one is common cold. Now, the common cold is caused by more than 200 different types of viruses. Yes, 200 different types of viruses. However, 50% of these common colds are caused by a group of viruses which we call as rhinoviruses. The symptoms of a cold include a runny nose, it includes nasal congestion, it includes sneezing, a little bit of sore throat, and a bit of cough. Fever in case of common cold is usually absent, or if it is there, it's usually mild. Now, symptoms of common cold typically last for 7 to 10 days, though remember in children, cough can persist for 3 to 4 weeks, and most of the parents they usually are very concerned about the cough once the common cold is settled. So remember that if you are dealing with these cases and the child is otherwise fine, you need to tell them the cough can persist for 3 to 4 weeks. Now, other main viruses apart from the rhinoviruses for this category, that is the common cold, it includes your non-COVID coronaviruses. It includes adenoviruses, which especially causes pharyngoconjunctival fever, in which you've got the upper respiratory tract signs along with bilateral conjunctivitis as well. And some of the parainfluenza viruses are also responsible for causing common cold. Then the next category is influenza. Now, influenza is caused by what we call as the influenza virus. Now, there are basically four types of influenza viruses: type A, type B, type C, and type D. Now, for clinical purposes, remember it's mostly A or B subtypes. C or D are not that much relevant. Now, symptoms of influenza include sudden onset of fever, and usually this fever is moderate to high grade. It does include a dry cough, which later might become a bit of wet cough. It can include sore throat. It does include fatigue, so the person or the child feels very much lethargic. It causes body aches and it also causes headache. Some children may also experience a bit of nausea, vomiting, and diarrhea. Symptoms of a typical flu infection or influenza, they usually last for 7 to 14 days. The third entity is COVID 19. Now, COVID 19 is caused by the SARS-CoV-2 virus, as you already know. I don't need to talk further about it. But symptoms of COVID 19 in children includes fever, which again can be mild, can be moderate, can be high. It's very tricky. I mean, it can present in any flavor of fever. It includes cough. It can include shortness of breath, fatigue, body aches, headache, loss of taste or smell, and sore throat. Now, some people with COVID 19 may also experience gastrointestinal symptoms such as nausea, vomiting, and diarrhea. In that way, it very much resembles with influenza. And I would later tell you that sometimes it becomes clinically very tricky to diagnose between these entities. But since the testing for COVID 19 is widely available, especially the lateral flow testing is very much available in the market, people can do it themselves. So it becomes a bit more easier in terms of diagnostics to confirm or refute COVID 19, especially if people have got access to the lateral flow testing. Now, symptoms can range from mild to severe, as I already told you, and may last anywhere between 2 to 14 days for COVID 19. Then coming down to RSV, which is the abbreviation for respiratory syncytial virus. Now, RSV is a common virus that causes cold-like symptoms. It can cause it in adults, it can cause it in older children as well. But this RSV is actually more notorious for the young age group, where in infants and young children, this virus can cause more severe respiratory symptoms because it usually starts as like a sort of an upper respiratory tract infection, but a few days it goes down. So it causes respiratory symptoms such as wheezing and difficulty in breathing. Other symptoms that might be part of this RSV infection includes, there might be a mild fever, sometimes there is no fever, there might be a bit of cough and runny nose and nasal congestion. Symptoms in case of RSV infection, they usually last for 7 to 14 days. So these were a few of the common viral infections of the upper respiratory tract in children. Now we will focus on how to differentiate between these infections solely based on symptoms and signs. Now, I'm deliberately not discussing the lab methods of diagnosis of these infections, as I want you guys to focus on clinical methods to differentiate between these. Now, the first, differentiating between common cold and influenza. Common cold and influenza share many similar symptoms, such as cough, sore throat, and runny nose. However, there are some key differences that can help differentiate between these two infections. Influenza tends to have a more rapid onset. So remember, while a common cold would slowly and gradually build up, influenza has got a more rapid onset with symptoms appearing suddenly and more severely than with the common cold. So while a common cold child might start with a bit of sneezing and then he develops slight cough which increases, and then he may later on have a little bit of fever, you would see that symptomatology evolves over 2 to 3 days. While in case of influenza, the parent should say that the child was fine, was feeling a bit like under the weather for a few hours, let's say last night, and all of a sudden in the morning he woke up with a very high grade fever. So he was fine, and then within a matter of a few hours, the child has got high fever. He's unwell, he's lethargic, he's not eating, and all those things which would be basically accompanied by any severe viral infection. So symptoms in influenza are more rapid, they appear more suddenly. So if that is the case, so if a child who is otherwise was well and all of a sudden developed upper respiratory tract symptoms along with a high grade fever, then you should be thinking of influenza. While in older people, influenza tends to go down and cause viral pneumonias, in healthy children, influenza rarely causes viral pneumonia, though in some cases it can go down and then might cause a viral wheeze as well. Now, influenza is more likely to cause high fever, as I told you. It's more likely to cause body aches. So if the child is older, you will see that they would be complaining of body aches, which you seldom get in common colds. They would be much more fatigued and they feel weakness. As I told you, common cold doesn't have got these types of symptomatology. So even if common cold, you've got a very bad congestion, you usually are otherwise fine. Differentiating between COVID-19 and other viral infections. Oh, I told you COVID-19 is a bit tricky. It shares many symptoms with other viral infections of the upper respiratory tract, including the common cold and influenza. However, there are some key differences that can help differentiate COVID-19 from other infections. One of the most notable differences is the incubation period, which can range anywhere from 2 to 14 days for COVID-19. But then the question is, who cares for the incubation period when the what you call the exposure is not even known in majority of the cases? However, if the child is older, they can tell you because COVID-19 can cause a loss of taste or smell, which is not a common symptom of other viral infections. So, in like for example, in common cold with nasal congestion, you can get a little bit of like a sort of a loss of smell and taste, but it is very much common in COVID-19. So, if a child is old, they can tell you. But younger children, they cannot tell you about loss of taste and smell. So, it becomes very challenging in case of small children. Additionally, COVID-19 have more chances of tracking down the respiratory tract, causing lower respiratory symptomatology like tachypnea and increased work of breathing with or without wheeze. So, as I told you earlier, because market testing for COVID-19 is readily available and it's cheap, most of the people do it on their own as well, and it's relatively easier, even in a what you call in a resource constrained environment, to test them for COVID-19. So, obviously, as I told you, clinically it might be a bit difficult to differentiate it between influenza and COVID. But as I told you, lateral flow testing can help you out in that particular aspect. Now, differentiating between respiratory syncytial virus and other viral infections. Now, RSV, which is the abbreviation for respiratory syncytial virus, this is another viral infection that can affect the upper respiratory tract. Now, symptoms of RSV infections are similar to those of the common cold, including cough, runny nose, and a mild fever. However, remember, RSV is more notorious in the younger age group because in children less than 1 year old, it can cause more severe symptoms because it has got a tendency to go down, causing difficulty in breathing, causing wheezing, and rapid breathing, which we call as tachypnea. So, RSV in children less than 1 year of age becomes more of a lower respiratory tract infection, though it always begins as an upper respiratory tract infection. In conclusion, remember differentiating between common cold, influenza, COVID 19, and respiratory syncytial virus, and some of the other viral infections of the upper respiratory tract can be very challenging, but it is essential for appropriate treatment and preventing further spread. So, by understanding the key differences in symptoms and signs, doctors can accurately diagnose and differentiate between these infections. So I hope this makes it clear to you guys on how to clinically differentiate between these entities in a resource constrained setting where testing may not be readily available. If you've liked this video, a thumbs up would be fabulous. Do share my video with your colleagues and don't forget to subscribe if you haven't subscribed to my channel yet. Stay tuned for more informative content coming up right on this channel. Bye bye.